Hello, good evening. Welcome back for another live episode of RevitaLive. Currently, we are in just beginning phase, I think the last few days of our CMCO, where there's a bit of relief in our MCO status that we were quite used to for the last couple of months. But don't be taken off guard. We still have to adhere to social distancing, wearing your mask, and of course keeping your hands clean and so on. So even if you're going out, please take precautions. And we at Glen Eagles, in most of the hospitals as well, we are taking precautions and the necessary steps to make sure that we do not transmit the COVID-19 virus. At the same time, some preventive steps to make sure that patients can come to see us in a very safe manner and to continue treatment for your disease conditions that you all might have as well. And now it's a great pleasure for me to introduce my guest, who is none other than Mr. Vimal K. Vasudeavan. Yes, it's even more special because he is my mentor and a very influential role in the development in my surgical career, and as well for the surgical career of so many other surgeons in Malaysia. Mr. Vimal actually is one of the pioneers of MIS, or minimally invasive surgery, as well as bariatric surgery in the country. And we're so fortunate to have him with us today evening to share and to discuss the concept of comprehensive care in weight management. Welcome, Mr. Vimal.
Thank you, Kiru, for your kind words. Not sure whether I deserve it, but thank you anyway.
Yeah, definitely, totally. I think I just bring you up to speed. The last few episodes of RevitaLive, we have been tackling the issues of obesity and its related conditions affecting the heart, affecting the joints, musculoskeletal, affecting the respiratory system, affecting diabetes and so on. So today we are going to put it all together and discuss the options in treating this obesity. So as you know, Mr. Vimal, obesity is currently a major problem, not only in Malaysia but the world. 33% of the population is actually overweight and about 30% is obese. And I think the WHO has also announced that obesity is a disease. Okay, and I think I would like to hear your point of view. Why do you think the prevalence of obesity is so high in Malaysia, and what do you think is the driving cause?
Prevalence of obesity is a twofold thing. One is people themselves, another is the government.
Yeah.
So people, sedentary lifestyle, availability of food at all hours, except maybe now.
Yeah.
Okay. But even now, people are cooking and trying a lot of food at home.
Yeah.
Lack of activities, especially now.
Yeah. And the other thing is, now food can be delivered to your house.
Yeah.
I
was worried before this COVID outbreak. At the ease with which you can get food to your house, I thought the BMI of Malaysians is going to become maybe number one in the world because of this availability.
Yeah, yeah.
So that is one reason. The second one is because of lack of effort from governments. Not only here, but you will say most of the world. Do you know that during school holidays, if you notice the pattern of advertisement in newspapers, media, TV, a lot of advertisement based on food industries.
Right.
Okay, things which appeal to schoolgoers.
I see.
Students.
Yeah.
So with the right kind of advertisement, you can entice this particular group to go for this kind of food. And some countries, some governments actually put a stop to this practice.
Yeah.
They don't allow advertising at a certain time, during the day or the night for a particular age group.
Yeah.
So after 10 they allow. So the young kids are sleeping.
Yeah.
So they control. But I think in our country there is no control over this.
Yeah.
So you will find the advertising pattern influences the young mind. social media patterns influence the young man. So all these are very important. So apart from the lifestyle, eating habits, lack of activities, government involvement also is very important factor. So all these has contributed to prevalence of obesity in our country.
Right. And I think another thing that I also observed, Mr. Vimal, is that the shift of the blame looks to be to the individual. That means either they are sedentary, they're not exercising, or they are basically eating too much of food and everything. What do you think about the environment? Do you think the environment that they are in itself plays a very big role?
Yes. Environment factors, especially social pressure, peer pressure, so depression.
Mm-hmm.
Okay?
Yeah.
So eating is habit forming.
Yeah.
So some people eat to escape maybe a bad
Yes.
experience,
Yeah.
a bad relationship. Maybe they are socially outcasted by their friends.
Yes.
So they enjoy the comfort of their room and eating. So this is how it becomes a habit and goes on to this. Alright? Of course, not all obesities are due to this.
Yeah.
There are also genetic factors.
Yes.
But the stigma associated is as though people are obese because they are overeating.
Yes, correct.
So we see this often in our practice, isn't it?
Yeah, that's true. I think a lot of them come to us and they most of the time they are quite sad, depressed, and they really want a solution, which we will talk about more after this as well. Another thing, Ms. Noel, do you feel that certain doctors do treat patients for their complications of obesity like diabetes, hypertension, tension, and so on, but they're not addressing the cause of the obesity?
Yes, this is again true. Treatment of complication seem to be something they can put their hand on, and they are also covered by most insurance.
Yes.
But treatment of underlying causes, prevention. We keep saying prevention is better than cure.
Yes, yes.
But here we only want to cure complications.
Yes.
But we don't try to prevent the underlying cause.
Yes.
Okay. Either by the society's nonchalance,
Yeah.
or the lack of financial might by the government concerned. They got many other diseases to fight against.
Correct.
Especially in these times.
Right.
As it is prior to this, there was cancer, there was a motor vehicle accident.
Yeah.
There's so many infectious diseases,
Yeah.
and now to throw a spanner into the whole work, COVID comes in and throws everything else out of the window.
Correct. Yeah. It seems that our health system, or even people's awareness, is more towards infectious diseases. When you have malaria, dengue, or even now COVID-19, it takes the center stage. Whereas non-communicable diseases like hypertension, diabetes, and everything, it's considered as a disease of lifestyle. So I think that's another thing also that probably we as clinicians have to offer more. So I think another thing that patients also have a problem is that not all hospitals can offer obesity-related management or treatment options for them.
This is true. This is one of the reasons why in Malaysia there's not much take up by patients with obesity.
Yeah.
There's still there are plenty of people who have this problem,
Right.
and they are not aware of the solutions. That's why you get a billion-dollar industry
Wow.
grooming beside the healthcare facilities who claim to manage obesity, who give them unrealistic dreams. People fall for it.
Yeah.
Many of them are convinced by it, and then later on they realize that they only spent a small fortune and didn't have much to show for it.
Right.
Some people have had the bad luck of having complications because of this. I think few years back you would have heard of this story. One of the actors from Phua the girlfriend had a liver failure, had to go through a transplant because they took some weight loss products, right?
Yes.
So because all these products come under food and supplements,
Yeah.
so they are not controlled by the the legal framework of the country which controls drug administration,
Yep.
like we are
Yep.
controlled, you know.
Correct,
So
correct.
they get away with a lot.
Yeah.
So people like the idea, oh, no surgery, must be safe.
Yes, correct.
You know, you just sit down and you lose weight.
Yeah.
Sounds very tempting. Who wouldn't want that, you know?
Yeah.
Then when they come to us, we tell them, okay, you got to do diet, you got to do exercise, you got to do surgery, stay in the hospital, come for follow-up. Well, it seems very drastic and exhaustive, you know.
Yeah.
Whereas what they are offering is so much easier.
Yes, correct. A lot of weight loss options are available out there, which is not even certified or is not even endorsed by any medical-based societies and so on. So again, the consumers sometimes it's supply and demand. When the demand outweighs the supply, then I think all these alternate measures and everything become very appealing to a lot of people.
So back to your question.
Yeah.
In Malaysia, let me go to countries which have this system in place, where
Yes.
there are a lot of clinicians managing obesity on a daily basis.
Yeah.
Okay, I think our common example is Taiwan.
No. Yeah.
Almost similar number of population,
Yeah.
obesity rates.
Yeah.
Okay, but the amount of work they are doing for obesity in terms of surgery and other things,
Yeah.
procedures,
Yeah.
far outnumber us.
Totally agree.
Okay?
Yes. Yes.
So we don't have to go far to look for experience.
Correct.
How are they able to succeed?
Yeah.
You know, why are we lacking behind?
Correct.
Because the number of people doing is low,
Yeah.
and not supported by the industry, not supported by the government.
Yeah.
So you are starting off in your back foot.
Yeah. Yeah. Totally. Okay. I think we brought the problem, and I think our viewers also will understand the magnitude of it and all. Now let's discuss about the solutions. So a lot of our viewers probably are asking, when we talk about a multidisciplinary approach to weight loss, what do we mean, and who exactly are in our team to help us in that?
Okay. I will give an example. So we have patients who call in, make an appointment, such as this. They see our show and then they call in, I got this problem.
Yeah.
So they call our clinic and then they come and see us in our clinic. And in our clinic, we have 2 trained staff nurses who we have trained as case workers. Okay, following the example of Taiwan.
Yeah.
So the nurses will ask a series of questions and fill up a pro forma.
Yes.
Detail the history of the patient, what is their, how long they have had this weight problem, how long, what are the measures they have taken, to lose weight, and what has brought them to our doorstep. Okay. After that, then they will go through body composition measurement. Okay, we have machines for that, and then they will go and see our dietitian and our physiotherapist. The dietitian will assess what is their nutritional intake on a day-to-day basis.
Yeah.
Because believe me, in my 15 years of managing this overweight patient, I've never had a single patient when I ask them, do you have eating problem? No, doctor, I hardly eat anything. This is the
Yes.
answer they give me all the time. I'm sure you agree.
Yeah, I totally agree.
You know?
When they say something, it seems like as if they don't eat as much as they say they do.
So we realize when we tell them about nutrition, a bit difficult. So we send them to the expert, who's a dietitian, who will work out how much they're eating as a baseline.
Yeah.
Are they overeating? Maybe they're not overeating, but their type of eating, habits are wrong.
Right.
Then we send to the physiotherapist, who also works out what kind of activities they do, how much workout they're doing. So then they will see either one of us, and then we go through all the data we have, and then we work out a program for them, be it conservative or surgery.
Yes. Well put.
So the team is based on this. Of course, we need with this group of people, we have others like psychologists, we have endocrinologists, we got cardiologists, sleep study experts. All these people work together with us because the treatment of this patient has to be overall.
Yeah. I think what Mr. Vimal said is very true. We have incorporated something that we call as a one-stop center, where we can look after the patient completely as a whole. Not only looking at the problems that they have, but also trying to find solutions and preparing them to the next step, which is what is the solution that we can give them towards the weight loss. And to add to that as well, We have certain adjunctive investigations that we do when the patient comes in. We have a body composition analyzer, very high end in our clinic, which we actually can map out and see how much is the fat composition the patient has, what is the lean body mass, what is the water component, and so on. So this all helps in providing a structure for the patient and deciding what type of maneuver we can use to actually lose weight. So, Mr. Vimal, to segue a bit from here, let's say a patient, we'll just give a case scenario. We have a 55-year-old teacher who's a diabetic, probably is having hypertension as well, with knee osteoarthritis. Okay, so this patient is evidently will not be able to go to the slimming center to get treatment and so on. They will definitely come to the hospital, and as a result of that, will get referred to one of us. Weight is about 120 kilos with a height of about 156 centimeter. So as you all know, we calculate the BMI using a formula that is the weight divided by height square, and you get a value. In this patient, it's about 48 kilogram per meter square. So for your information, anything above BMI 40 is a morbid obesity or grade 3 obesity. So, Mr. Vimal, based on these options, what can we offer the patient?
Okay, usually these kind of referrals, patients would have gone to the orthopedics.
Yeah.
They would have been suggested knee replacement, because of arthritis.
Yeah.
But most orthopedic surgeons who are concerned about their results will generally not operate on those with very high BMI because of poor outcome.
Yes.
And higher risk of complications.
Yeah.
So what do? Most of them will refer the patients to us to ask whether we can help these patients out with their weight,
Yes.
let their weight reduce to a manageable level, and then they will do the surgery, which will in fact have better outcome.
Okay.
All right. So that's how we are involved.
Right.
Okay, so when these kind of patients come in, very high BMI with comorbidities like hypertension and arthritis, maybe needing a replacement, then we will look at this patient. Of course, the initial assessment, body composition, everything, dietitian and physio.
Right.
It's easier said than done. When your BMI 48, it's not possible for you to do exercises, especially with arthritis.
Yes, correct.
And if you keep telling them to do dieting, they will run away and not come back because they have heard that answer a million times.
A million times, correct.
So this patient technically needs surgery or a procedure at least.
Yes.
Okay, so we'll work out on that basis.
Yeah. Yeah.
So I think in surgery, maybe you can explain a bit.
Correct, Mr. Vimal. So the surgical option that we have can come in two forms. When you talk about surgery, of course, we talk about a procedure whereby we give anesthesia and we do it laparoscopically. Okay, and that is what we call as bariatric surgery. When we talk about surgery for the remission of diabetes or for the treatment of diabetes, we call it metabolic surgery. So there's a difference in that. Before we proceed for surgery, we will discuss with the patient the options that we have available, and if the patient chooses a non-surgical option, whereby the patient is not comfortable with taking medication and so on, probably the patient will be interested in doing an endoscopic procedure. An endoscopic procedure whereby we put in an intragastric balloon inside the stomach. So this balloon will stay inside there, occupy space, and act as a restrictive mechanism, so preventing you from eating further. It has some small endocrine effects, not much, but primarily by restriction, you will tend to lose weight. Most of it will occur in the 3 to 4 months once the balloon is there, and once the balloon effect has come down, the weight starts plateauing. After about a year or so, then we will remove the balloon again by endoscopy. So, Mr. Vimal, now we have a revolutionary new balloon.
Yeah. Talking about balloons,
Yeah.
I know there's a revolutionary new balloon,
Yeah.
and I know that you are the only one so far in this region
Yeah.
to be trained in the use of this balloon.
Yeah.
Okay, I think you are the best person to talk to the viewers regarding this balloon.
Yeah, thank you. Thank you. So the ellipse intragastric balloon is a new what you call as procedureless balloon. Why do I say no procedure? Because it is non-surgical, non-endoscopic, and also non-anesthetic. Basically, you come in an outpatient basis. You come to the hospital. We just do a simple workup for you, and if you're eligible for it, ideally your BMI should be more than 27, and it is best for those, even for grade 3 obesity, we can consider it, but probably your weight loss will not be as good as surgery. Okay, and basically how it's done, you just swallow it, and there's a thin catheter that is attached to it. You can connect it to the solution that comes in the package, and basically it will inflate the balloon inside your tummy, and this will act as a restrictive mechanism, and it will stay in your stomach for at least about 4 months, or 16 weeks. And you might be wondering, how does the balloon come out after that? Well, it is got a patented mechanism whereby it just disintegrates and the balloon will pass out together with your stool. Okay, so this is keeping it very simple. Of course, during the period that you have the balloon with you, you need to follow a very precise diet and lifestyle modification, which we will guide you. And the interesting part about this program is that you will have an app that will be tied to your device, which is in the shape of a weighing scale, where you can measure your weight every day in the morning, and that signal will come to our clinic, and we'll be able to monitor you, we'll be able to follow up with you, and I think this is the essential component in this whole weight loss program.
I think this balloon is going to be a game changer.
Yes.
Because one is there is a stigma associated with surgery.
Yeah.
Most patients, I think in our experience, you would have noticed, even for other surgeries, patients want to explore other avenues and keep surgery as a final avenue, right?
Yes.
So similarly for obesity, the moment you start talking about surgery, a lot of them run away. Compare this with Taiwan. Most patients, once they have gone through and realized the benefits, at this point in time, I think our common friend, Professor Huang, what he says is patients actually walk in, family members walk in and say, I want the procedure.
Correct.
So you don't have to convince anybody.
Yeah.
People just walk in and say, I want this procedure.
Yeah.
When you try to convince them, he said, no need to convince doctor, I already know.
Yes. It's very
So
true.
we are still going through that phase where we are trying to convince people.
Yes.
Whereas the rest of the world, where these things are being done, they are already convinced.
Yes.
It's just that the number that they can accommodate.
Yes, very true. In fact, Mr. Vimal, when I was training with Prof. Wang in Taiwan as well, as you said, a family of 3 of them, the father, the mother, and even the son, came in together, and as a family decided that all of them want to have bariatric surgery. And they know the mother is a diabetic, she's on medications, on insulin, and she is aware about the option that metabolic surgery is available, where we do it laparoscopically, and by doing certain modifications to the gastrointestinal tract, by modifying, connecting the small bowel to your stomach, you can actually cause the remission of diabetes, can actually reverse diabetes to a certain extent. So these are all the options that is available, and people who are more aware, and I think soon even Malaysians probably will come to that level, Mr. Kumar.
So I think this balloon is good option for those with high BMI but not the extremely high.
Correct.
And who have no medical problems.
Yes.
Metabolic syndrome, hypertension, diabetes, sleep apnea.
Yeah.
They just have overweight problem.
Yeah.
And they want to do something about it. A bit of restriction.
Right.
Put a balloon in, no procedure, and then you pass out the balloon after 4 months.
Yeah.
And then in the meantime you lose weight. I think you were saying something about 15% of the weight loss, right?
So far with the balloon, we can lose about 12 to 15% of your body weight, translates to about 15 kilos roughly. And I think the latest study that has come out now, Mr. Vimal, actually it shows a sequential balloon. So the balloon program we offer lasts for about 6 months, where you swallow one balloon, then it comes out, and as you lose 15%, once you the balloon is out for about a month or so, you take in a second balloon. Okay, this time from the 15%, you will lose about 10 to 12%. So the total cumulative over that 1 year will be almost 20%, which is reasonably quite a good weight loss objective. But again, we have to choose the candidate, and we have to determine in the beginning itself whether you are this option will be the best for you.
Is the balloon available everywhere?
No, Mr. Vimal. At this moment, the ellipse intragastric balloon is only available in Penang, and it's only available in Gleneagles, Penang. So I think feel free to contact us. We have, I think after the show as well, we have our contact number for our clinic as well. Can get in touch with us, and probably we can give you a consultation to explain on furthermore.
So going back to our previous case you were discussing, this patient is obviously a very high BMI.
Yes.
And they've got comorbidities, So I think surgery probably is a good option. Do you agree?
I agree as well.
So what would you do for this patient?
So patient is a diabetic, hypertensive, with osteoarthritis. So basically what we'll do, we'll put the patient on a plan to take a very low caloric diet to actually bring down her weight before surgery. We do this as a practice, both of us. Why do we do it? Because we have this entity where for these patients, the liver is very big, floppy, infiltrated with fat. It's called fatty liver. This is because the energy during that time will be converted and stored as fat into the liver. So we basically shrink it over a period of 10 days to 2 weeks before surgery to allow the liver to firm back. And we do this surgery by laparoscopy. We put in a camera, 1.5 centimeter incision, where we put in a device called a trocar and we put a camera inside. And we use another 4 laparoscopic pots, one for something to assist in holding the liver up so we can access the stomach, another 2 more for my right hand and my left hand, and as we assist each other during the surgery, 1 more placement for the device for our assistant to hold. And doing this with these 5 holes, we can complete the whole surgery. And we have options, Mr. Vimal. We have, as you know, the sleeve gastrectomy, where we divide the stomach to leave a 1/3 of the portion of it left behind, which forms a restrictive mechanism. And if the viewers feel a bit confused, please visit our website, Penang Weight Loss Surgery Clinic and Surgery, and you can find this on Facebook. And we have all our images, videos, and whatever that we're discussing is all available on social media as well. And of course, for this patient, ideally the best option for her would be the Roux-en-Y gastric bypass, where we make a small pouch in the stomach, in the upper portion, and we go down and we take a segment of the intestine, the jejunum, and we bring it up and we join it. So the reason why we do that is called a bypass, intestinal bypass. And by doing this, you actually bypass a segment of the proximal part of the intestine where the pancreas is situated. And we find that by doing this, it causes incretins, the hormonal effect of bariatric surgery. A lot of people think that by just doing surgery, we restrict the size, make it smaller, is the reason why you lose weight. But we know the scientific mechanism for weight loss is in surgery is tremendous. You have the effects because of the hormonal, where your hormones like ghrelin actually come down, reduce your hunger, and hormones like GLP-1 go up and induce your satiety and preventing you from feeling hungry further. And we also know there's a lot of gut microflora, the change in your bowel contents and everything can cause mechanisms that we still do not know 100%, but they actually work and prevent you from gaining weight and maintain that weight loss for a very long duration. So I think these are the mechanisms that probably is more beneficial in certain patients who are obese, or what we call as super obese, where your weight is more than 50 BMI.
You spoke about GLP.
Yeah.
I think we also have a product which is similar, right? In terms of injectables.
Correct, Mr. Man. I think when the good part about doing surgery is that they find a lot of hormonal consequences that happen. And pharma companies, like in this case, like example is like Novo Nordisk, they actually found that by manufacturing this GLP-1, which is actually used for the treatment of diabetes, and a certain higher dose, it can actually cause weight loss and improve your satiety and so on. So maybe Mr. Vimal, you can share in your patients that you have used before this, right?
Yeah.
How do you find
this
it
is
by using it?
a new drug also.
Yeah.
We have been using for the last I think close to a year or so.
Yeah.
And it's easy to use, self-injecting. Of course, people worry injecting is painful.
Yes.
But you are reassured the needle is smaller than your insulin needle actually, and my nurses actually trained the patient to self-inject.
Yes.
Most of the time, according to my nurses, after the first or second visit, the patients don't need to be told how to do. They are quite they are quite able to do it by themselves.
Yeah.
And the weight loss is pretty steady. One of the main important side effect is nausea.
Right.
And very rarely vomiting,
Right.
which is quite easily managed by adjusting the dose of this drug, Saxenda. We start with a low dose so as not to induce vomiting,
Right.
and then step up over first 5 weeks into the dose which actually brings about weight loss.
Yes.
The good thing is, even with this impact,
Yeah.
they still lose weight.
Yes, correct.
Okay,
Yeah.
so again, it's a good alternative to those who are in the same class as those requiring a balloon.
Right, correct. And the other thing that we find is as well that patients who need this GLP-1 analog medication is not widely available around. You can't go to a pharmacy and buy it, and you need
Good for us.
yeah, you need a team-based approach. None of these weight loss mechanisms can work on its own. You need to have the comprehensive with the diet, the exercise, and and for you to get the best benefit. So allow us to decide or to discuss with you the options that you have and come up with a solution for you. Mr. Vimal, shall we take some questions?
Sure.
Yeah. So in between the show, normally we'll go through and see. So we have Nining Mustikawati. Hi, nice to meet you. I'm Nining from Cianjur, Indonesia. So nice meeting you. Hope you are in good health. Yes, thank you. And then we have Dave Kumarendran. Hello, docs. Keep up the wonderful work. Thanks, Dave. Keep rocking. And then we have Hello Ning, Roy, Alice Priya, and then Lai Bun Mi and Lenny Krishnanwanti. Yes, thank you very much. Okay, so coming back to some questions. So I think a lot of patients will be asking if bariatric surgery is indicated, how safe is it? Because the rumor is that when I go for surgery, I might not wake up. I might die on table, or I might wake up and I might have some severe complication and my whole life is gone. So maybe that is the reason why a lot of people tend to shift away from surgery.
This stigma of surgery is not particular to obesity or bariatric surgery alone.
Right.
Even when patients want to go for any surgery, they have this fear. Okay, this is probably as long as the practice of surgery has been around. Okay, but from the time surgery began to now, there are many changes which have taken place.
Right.
Anesthesia, which was unsafe before, is very much safe now. So it affects the outcome.
Right.
Patients recover much more smooth,
Yes.
and they feel comfortable.
Correct.
Pain medications have improved so much.
Very true.
Complication rates have reduced as a result of pain relief.
Yes.
Okay. Surgeries, how have we improved? Surgery is undergoing a revolution now. Everything is becoming minimally invasive surgery.
Yes.
Okay, whatever we can do minimally invasive. Most scientific studies have proven that MIS, minimally invasive surgery, results in better short-term outcomes.
Yeah.
Okay, and comparable long-term outcomes, especially for cancer and all that.
Yes.
So we can send patient home after a few days,
Yeah.
even the same day after
Yeah.
surgery.
Yeah.
Now a lot of surgeries, gallbladder, hernia, all these have become minimally invasive or laparoscopic surgery has become the gold standard.
Yes.
Okay, so we can almost guarantee good outcome.
Good outcome.
Okay,
Yes.
so because of this, patients prefer surgery now.
Right.
Okay, of course, in diseases which have option of surgery and non-surgery, there's still some worry that patients only come for surgery if there is a clear benefit,
Right.
or their medications are not working.
Right.
For example, reflux and
Right.
all that. Okay, but not many people are doing,
Yes.
so they are not aware.
Aware.
So this is still an obstruction we are still attempting to maneuver.
Yeah.
Okay.
I think so also, because when we talk about safety in bariatric surgery, if you look at most of the studies that are done nowadays, the complication rate is less than 1%. So it's almost as safe as going for a laparoscopic cholecystectomy where you remove your gallbladder, or even for a knee transplant. Of course, this is in the best of hands, Mr. Vimal. So if you have, like between us, I think experience of more than 20 years of surgery, and of course in bariatric surgery, we've been very well trained, and you have the expertise, and you have the team, and you have the the whole setup for you to do the surgery safely. Then I think that is the best option.
Yeah.
So you have to find the center.
When we're taking consent for surgery for bariatry, the list of complication or potential risk we have to go through is quite extensive, almost a page long. But then, so when you tell patients, we are required by law to explain everything, right? So when we go through the whole page, then you notice the patient getting worried. But then you tell them, you see the percentages are less than 1%, less than 1%.
Right.
No form of surgery can guarantee you more less than that.
Correct.
You cannot guarantee.
Yes.
Like I tell my patients, if you want a guarantee, you try crossing the road. If the light shows you can cross a road green, you can still be hit by a motorbike.
Very true.
So the risks are there, but carefully planned, carefully explained, well prepared will guarantee safely a good outcome. Not 100%. Nothing in life is certain like that.
Yeah, I think that's well put, Mr. I think you gave a very good analogy. Nicole Ling, yes, I think that's a question that you asked, and I hope that we have answered it. Okay. Another very important thing that I think a lot of our viewers will ask, Mr. Vimal, that is very subjective, and it's always a concern when they come and visit us in clinic as well. Doctor, why is the price so high?
Okay, how do I put it? Cost is always an issue. Okay, cost in healthcare is more so. Cost in healthcare in the private sector is even more so. Okay, we are willing to buy the best pair of shoes, the best pair of handbags.
LV.
Okay, we heard a lot of names, right, in the last few years, huh? Watches, handbags, people are willing to buy. Okay, I agree, this is out of reach for a lot of people. But here, you're buying a certain lifestyle, a certain targeted health, So, everybody says, health is more important than anything else in life. So, why can't you spend for your health?
For your health, exactly.
Okay, when you're obese, these are the complications which you will develop in your later years. And treatment of those complications will cost you a lot in later years. Okay, now you also have the knowledge that these are the things available to prevent your suffering in later life. So a little cost now will save you a lot in the long run.
Correct. I totally agree. And the way that I look at it as well is your health and is the only wealth that you have that can take you long in your life. If you invest, if you already know you're having a problem with your health in your 30s or 40s, if you decide not to take action during that time, thinking that, that we have this FOBO mentality, where it's the fear of better options, and you keep postponing it, and you lose this vital period that you can do something because you're worried about the cost, or you're worried about the risks and so on, and you have not made the effort to find out about it, or to even consult someone who probably has more information to give you the guidance and so on, then like what Mr. Vimal said, we feel that you are the one who is actually missing out, because in the end of the day, you have your dependents to think about, your family, your kids, and if the breadwinner of the family itself is not well, or having a lot of issues, that could be a major problem. Another thing, Mr. Vimal, is there any alternative for
fear not, if cost is all you're worried about, I think as a team, we have been working on this for quite a few years. We approach all the stakeholders. Okay, now who are your stakeholders? Insurance. Now the biggest problem with insurance is there are many countries in the world where insurance covers for bariatric surgery, especially for morbid obesity, diabetes, hypertension. Yes, they are very strict on that.
Yeah.
US, UK, many parts of Europe, Australia, New Zealand, they cover. In Malaysia, it's not covered. So many years ago, a few of us approached the insurers. Why is it that your same company covering elsewhere but not here?
Yeah.
So the explanation they gave us then was, our premium, our patients pay in Malaysia is far less than the premium paid by the foreign patients in their own country.
Yes. Okay.
So with that premium, they are able to support bariatric surgery.
Right.
With our premium, they are not able to support. So they have had to go back to their actuarial officers and rediscuss new premiums for those. But this was more than 6-7 years ago. Until now, they haven't come back to us. Okay. So for the time being, insurance probably is out of the question.
Right.
There are some insurances which cover for bariatric surgery.
Oh, in
not
Malaysia.
available in Malaysia,
Okay.
but neighboring countries they are there.
Yes.
Okay.
Yeah.
So I'm not. I don't know much about those details.
Yeah. Okay.
But for foreign patients who have those insurances, maybe.
Okay.
Then we have for people who have EPF or KWSP contributions.
Right.
Okay. About 3 years ago, we managed to get approval for EPF to cover account 2 withdrawal for bariatric procedures.
Right.
So this is a big breakthrough.
Yes.
Okay. Hope the rest follows.
Yeah.
I think with the hard work that the two of us with our team put in, another option available to patients who come to Gleneagles Penang only is availability of fintech mechanism. For those who don't know, this fintech actually is not your along. It's available even in countries like US and UK and European countries. Okay, what they do is a group of stakeholders.
Right.
They lend out money through the banks.
Right.
In the case of Malaysia, they work in hand with Bank Negara.
Right.
They have all the work done to get and have got approval from Bank Negara and multiple banks within. Okay, and patients can actually withdraw as a loan.
Right.
Okay, and the loan it can go from 1 year to 10 years.
Wow. Okay.
Tenure. Interest rates much lower than if your personal loan.
Okay.
Okay.
Right.
So this loan is designed for patient to pay to the hospital to undergo bariatric surgery.
Okay.
All right, or a balloon. Okay. So for the time being, they are only approved for Gleneagles Penang.
Right.
Because of the efforts we have put in.
Right.
So we must thank Johnson & Johnson for helping us with this endeavor.
Yes.
They did a lot of paperwork to help us.
Yeah.
So now this fintech loan is available for both government servants as well as private private workers.
That's excellent news. Yes.
Yes.
Yeah.
So you can take a loan. Suppose the cost of the surgery, say balloon, it comes to about 12,000 or 13,000.
Right.
If you have no money in hand, you can take a loan from fintech.
Right.
The application is online, the approval is online, about 3 working days.
Wow, that's excellent.
Okay?
Yeah.
So you can pay your loan in as short as 2 years. So by paying about say 500-600, I think just now we did a calculation, right?
Yeah.
500-600 ringgits a month.
Yeah.
You can pay for the balloon over the next 2 years.
2 years, yeah.
Okay. If you are going for bariatric surgery, of course the amount is more, maybe about 40,000, 30 to 40,000.
Right.
So you also can take, and then they will pay you the amount. So the private hospitals, they will accept the fintech money, and then you pay. Just like you go to a mall, suddenly there's something you like, you buy a phone, and then they give you 0%, but this is not 0%. So you apply for a loan and you pay yourself. So take charge of your life.
Yes.
You take a loan, get a procedure done, you pay the loan back, and then you get healthy.
Yes. I think this is a very workable and a very revolutionary option that future patients also will not be able to say that, oh, I didn't have this option or I never knew about this. So that's why a part of our strategy or the show that we're doing is trying to impart knowledge for all our viewers so that you can take home this message and probably share it with your family and friends.
So the target by this company, FinTech, is for the next 1 year or two to just concentrate on Gleneagles Penang.
Right.
and then see whether the model works.
Right.
Okay, and after that they will open it up probably to other hospitals as well.
That's very great. I think it's a very
so I think it's
promising.
probably a game changer. Unfortunately, due to the COVID situation, it brought a halt to all this work.
Yeah.
So now I think it's restarted.
Yeah. Actually, they started back this week. One is because I think partial of the CMCO at the moment or so, we find people are still able to move around more, and even for our services like bariatric surgery or elective surgical procedures are now on the up and rise. So we can actually start back, in certain cases based on availability and so on. So contact us.
I think, in fact, if you want to know more about these financial arrangements, when they visit our clinic, our nurses will give them the necessary paperwork or help them out with the online application and all that.
Okay.
So we have nothing to do with the application. We just help you do the application. It's your own process. You apply, you get the loan, and then once you have the check, you pass it, you come in, and then you go for the procedure.
Okay, Mr. Vimal. So now we'll just run through the whole whatever we discussed today. So if a patient now looking at this, our program today, you decide, yes, I have problem related to my overweight or obese. What do I do? So you can see our contact number. Either our Penang Weight Loss or Gleneagles Facebook page. Just make an appointment. Leave your data, your information, your phone number. We can get back to you, or you can leave a message to us by WhatsApp, and we can actually get back to you to give you virtual information counseling. And of course, we can schedule an appointment finally, because a lot of what we decide will depend on you physically being present for us to evaluate and to decide what is the best treatment option for you. Mr. Vimal has clearly noted about the different options you have in terms of financial packages and so on. Of course, there is more options which we will give you when you do come to the clinic. And finally, on my part, Mr. Vimal, I'd like to implore to our viewers, don't fall victim to your by saying that you're ignorant and you do not know what are the options available for you to overcome this problem. And second thing, the fear of making a decision. The fear of something better may come along in the future. I think we should take it a day at a time. Now with the COVID infection, we know how precious life is, how situation can just change. And all our lives has changed for, we're not sure whether for the better or for the worse. We probably know that in the next couple of years. But at the moment, we have to deal with what we have, and we have to keep moving forward. On your part,
there's another thing, question. I always get asked when patients come and see me.
Yes.
Doctor, do you do liposuction? You have heard that too.
Yeah,
so what do you think?
Maybe
you should clarify with our viewers.
Actually, liposuction is basically putting a device and sucking out the fat. That is a plastic surgery procedure, or what we call as aesthetic procedure for body contouring, to make you, you already lost weight and you find your in the region around the tummy, you probably have excess fat, so you go for a liposuction procedure. So that is not a bariatric procedure, and again, liposuction is not a permanent procedure. Once you suck out the fat, if you don't adhere to lifestyle change or whatever, you will deposit fat back in the same place again, and you have to go for another procedure.
We use the expertise of plastic surgeon. Normally, after our bariatric procedures, maybe about 2 or 3 or 4 or 5 years later, when they have a lot of flabby skin, a lot of random fat around deposits, we want help to get rid of those. The patient wants, then we will refer to a plastic surgeon.
Okay.
But other than that, in the initial purposes, when patients come, there's no role for plastic surgery from our side as bariatric surgeons.
Okay, Mr. Vimal, it's been a pleasure having you. I think time has flew so fast. It's almost an hour. Is there any final take-home message that you'd like to share with our viewers?
Well, you all know the problem. The whole country knows the problem. You were not aware of the possible solutions. Now by Googling or watching this episode, you will know the possible solutions. So now the ball is in your own court. You have to decide, what am I going to do about my weight? Okay, what am I going to do about my son's weight or my wife's weight, or my don't neighbor's weight lah. Okay, so do something. Okay, feel free to make an appointment, come and see, take charge of your life, and let us help you. That's all.
Yeah. Thank you, Mr. Vimal. That's excellently said. Again, the contact details are available, as you can see up there, and also on our Penang Weight Loss Facebook page, Glen Eagles website page as well. You've been a wonderful audience. For all our Muslim viewers, selamat berbuka puasa, and for everyone else, we hope you had a great day, and stay steady, and hope to see you soon.